Thank you. I just downloaded it and entered all my data in. And question I have is that it picked up my zip code here, which I think is a high-risk area, right? Right now, the air quality is pretty good. What happens when I fly back to North Carolina or some other place? Uh-huh. Okay. So I have to change it though, or it won't automatically see where I am and then report that? Okay. All right. Yeah. Right. Yeah. So that's great. So the solution then is we increase symptoms of people, and that'll motivate them to change behavior. The risk perception is a problem, isn't it? Because people have very poor judgment around risk perception and how to present that. Are there ways, through, we can drive from behavioral economics or other components that can actually improve that? Is that something that you're looking into? Okay. Yeah.
Just, in behavioral economics, in air quality, it's a little bit more difficult, right? Because we're not selling a product, and so the learning over time and changing behavior over time is very difficult, particularly when the hazards such as air quality or wildfire smoke has actually very low risk in most people.
Yeah, I mean, I see a lot of patients.
So the key is to know how to act when you're being exposed immediately so that you don't get to those high severity outcomes, right? But there is no that knowledge base of, like, you see smoke, you know what to do, right? You continue doing what you do, and then you experience symptoms, and then you start acting. That's our natural tendency.
Right. So that's very different than some medical conditions, like I see a lot of patients with cancer, for example, and they overestimate the risk because of the word. And so then that they actually have. And if you have, say you have a 5% chance of having a recurrence, that's very different than saying you have a 95% chance of not having a recurrence. They respond very differently to that. Similar kind of things, different, but similar kind of things in this area. So we have about, 10, 15 minutes for questions, discussions. Go ahead, Catherine.
Great, thanks. Hi, I'm Katie Conlon with UC Davis. I love this panel. I love this because so this is a comment/question. So one of my areas of research is the interest of translating science to practice within the space of climate and health adaptation. So I think Lauren did an excellent job of describing what types of public health interventions can be done around climate drivers, specifically wildfire smoke. I love the plug of the CDC Climate and Health Intervention Assessment, which I shamefully was involved in, but I think a lot of folks might find it very interesting. So when I talk to people about ways that we can think about collecting more evidence around certain climate and health interventions, I point them in that direction, because while, to Lauren's point, there is a paucity of data about the evidence for certain interventions that work or don't work around certain exposures, particularly for wildfire smoke, there are a lot of different activities that can be adopted for different climate drivers and climate-driven exposure. So wildfire smoke is a great example of that. For instance, there's a psychological first aid training example in that intervention assessment that can be and has been adopted for some public health departments who are dealing with wildfire smoke. So to translate to Anna's presentation, which I think was really helpful, your point about the exposure reduction behaviors, did I get that right, ERBs? Is there an opportunity to potentially link the intervention assessment to the SmokeSense app, or have an opportunity for users of SmokeSense to input behavioral changes that they're undertaking and then maybe back categorize it or characterize it with what's in the intervention assessment? Because I think that might be one of the ways in which we can start building some of this evidence around the various behaviors we can take to protect ourselves during smoke events. So that was a long-winded way of saying, is there a way to modify that so these
I think
really
so,
useful tools can start
particularly-
talking together?
I think so, particularly if you have the ability of, and so Smoke Sense works at a national level, right? We don't have it's all anonymous and we don't have interaction with the user directly. But you can certainly envision the type of studies that do intervene more, that use something like Smoke Sense and enroll in a cohort of people and follow them through time and measure their health outcomes. And
Kathleen?
Hi, we have a question that was sent in from the web. So the question is from a Karen DeGans or DeGanis, I'm sorry, I don't know how it's pronounced. And I believe it's a question for Lauren. Do any of the localities designate places as vulnerable based on the mapping exercises? And have localities had any issues with businesses not wanting to move in or insurers not wanting to provide insurance based on those maps?
So when we first went into Hope County, we brought the map kind of as it was from the EPA, which you can go to Anna's group's publication and see what the map looks like for the whole U.S. on, I believe it's like Community Health Vulnerability Index for wildfire or something like that would be, plus Anna's name would get you the paper. But, and you know, our first ask to the community was just like, do you agree that there's this vulnerability? And so, you know, when you know, we had like 20, 30 people show up from a variety of different backgrounds that wanted to discuss the map we were proposing in detail, we do feel like they agreed that there was some vulnerability there and then had feedback for us. And then one of the, if you noticed, I didn't get to say this, but it's nice the question gives me an intro into this, is the map is called a Smoke Vulnerability Index, and that in part came from people in the community who had both lived with one of the either prescribed burns or wildfires directly affecting their like property, and then also kind of the foresters who saw it as more of a like smoke exposure issue, but there was a lot of sensitivity around using the term wildfire because of implications for insurance and emergency response, and then also people wanting to differentiate from what we were talking about, which they really saw as smoke exposure as opposed to talking about the wildfire itself.
Other questions, comments? I love the idea of being able to connect what we've heard on the last panel and on this panel also in the area. I mean, we heard about leadership, we heard about training and education to build resilience, and now we see a couple of things in terms of curriculum, in terms of public health apps, in terms of surveillance survey that you're actually looking at, you know, what are people doing, what is their perception in those areas. In the military, again, drawing my experience in that area, we do have something called trauma first aid, and it actually connects a training program to prepare individuals for anticipated trauma in those areas. And the educational component helps mitigate the fear. They also embed into it some fear mitigation skills, mind-body techniques, for example, that help teach people how not to panic and to you know, think more clearly about what they need to do and what behavior they need to change as an actual skill. And then they run through simulations of those trainings to actually, so that they actually get that skill and show that. Is any of that going on in North Carolina, California, around you know, this issue? Oh, I see a shaking head, nodding head.
I guess this is not exactly well, actually, I don't know. No, it may be oriented towards preparing for future events, but I know that there have been really major efforts in the 2017 counties, particularly Sonoma, and now in Butte, around mental health and broadly developing skills in people who are not mental health professionals for dealing with the people that are around them who may be going through a very traumatic kinds of experiences in terms of their symptoms, mental health symptoms. You know, some of that's been supported through public agencies, and a lot of it has actually been supported through philanthropic organizations that have really put money towards that, because there has been, I mean, it was such a traumatic event for, you know, the 100,000 people who evacuated. You know, many of them were driving, as the firefighter was, through flames on both sides of their car, worrying about whether their tires were going to melt and they weren't going to be able to get there. There was so much traffic. There's not a lot of roads going in and out of some of those towns in Napa and Sonoma, and they're not very wide. So some people were on the road for hours trying, you know, hoping that they were not going to get trapped in their cars. So the degree of trauma was enormous. And, you know, from talking to people, there was a sense of a group trauma that was different from kind of individual trauma that I sensed. And you know, we would get on the phone with some of our phone calls with some of the county people, and at a certain point in the middle of the meeting, they would stop and they would say, "Well, you know, we are all so traumatized. You know, you go to the grocery store and you run into somebody you haven't seen for a few months, and within minutes you're crying and hugging each other." And so I think that there's some really good, you know, I don't know all the details of the activities, but I know there's been really some very big efforts, and I imagine some of those models can be exported to other, you know, other places. One thing that always stuck in my mind, this one organization, I spoke with the woman who was running it, and she was describing all these different people that they were, different groups that they were training in mental health, you know, how to deal with people having trauma. And, you know, she mentioned, because I do yoga, it stuck in my mind, yoga teachers. They did a workshop where they had, you know, 50 or 60 yoga teachers, and they were, you know, helping them for how can they help the people come to their classes and dealing with trauma. So
I'm struck by some of the folks who have experienced this trauma, responded and recovered from it, are now some of the very resilient, most resilient individuals also for educating those in the future. This happens in the Veterans Administration. They use peer-to-peer counselors who have themselves had exposure to trauma and PTSD and that type as the support factors for helping people to actually get through that. And also down at Katrina, when Katrina pretty much wiped out New Orleans, there were no mental health providers there to deal with the capacity that was needed at that time. And in fact, it was the people from the local community who came forward, who had some resilience, perhaps didn't experience as much trauma, but were part of that, their neighbors that came out, and some of them may have had some type of ability to address those areas. Yoga practitioners, acupuncturists, et cetera, actually became a key part of the support for that community resilience. And faith-based communities, huge part of the support in that area. So, question back here.
Hi, Colleen Ryan from the American Burn Association. Two questions. Again, I'm always like a two-question person. But the first one is for Lauren. Have you considered coupling, along with your smoking, maybe you already have it as a simple bystander care, first aid, like Cool the Burn? I mean, it would be very simple, you know, when you're educating people about, you know, what to do with smoke. With their smoke, there's probably going to be fire. And to have, you know, as someone that treats children at the Shriners all the time, and people still put tomatoes and cut potatoes and toothpaste on their burns and not just cool water. And it would be very, very helpful to partner with us and have a simple flush the burn with cool water for 20 minutes message as a little module part of your teaching program.
Yeah, I mean, we'd really welcome that. We haven't gotten to do that as much with wildfire smoke, but with our climate and health adaptations around heat, we've really been integrating it more and more with, you know, for example, our hydration messages for farm workers. You know, we attempt to combine those with, you know, healthy fluids. Like, this is actually an example of something we pass out. So like how to make things that don't taste like water, that are not filled with sugar, because a lot of people don't like to drink water. And then we combine it also with like electrolytes training, like sun protection and sunblock, and then also the people who disseminate it to farm workers combine it with like pesticide training. So there's no reason like on wildfire smoke where we couldn't combine sort of the messages with other important health messages.
So the other thing is a little bit broader with my forum hat on, is, you know, and my trauma hat on, is considering the 5 stages of trauma preparedness, how you have to have bystander care, pre-hospital care, hospital care, rehabilitation care, and recovery care. There isn't any reason why we can't think about these things beforehand and have prepared beforehand. For instance, you know, you hear a wildfire going on, why you can't have public services messages prepared that get tweeted out and sent out beforehand, what to say to your children about your house being put on fire, what's the best way to do that, and have you know, constant things about what is a burn center, or how to manage this, how to manage that, things to prepare you mentally to be resilient. And in terms of our research program, not just to study, you know, all the gaps in knowledge, but to really focus on these people that are doing better. I mean, look at Memorial Day that we just went through. I mean, you know, the people like my father who, you know, just go off to the side for a little bit. You know, he released the concentration camp victims in World War II, you know, and then they come back and, you know, they say, Michael Charlie, continue, or Charlie Michael, continue mission. You know, they go off, they're quiet for a little bit, and they come back, continue the mission, and they keep going on. And there needs to be some way to study resilience, and it's been with humans forever. And we need to understand through stories like this one that was just named, through people who are beginning to understand resiliency, like the Phoenix Society for Burn Survivors. Burns, in fact, are really a very identifiable microcosm of the trauma community and an understanding of a horrible trauma that people can live through and have their whole life, and understand some of these psychosocial issues. And I think this has been probably one of the most wonderful sessions I've ever heard on these sort of things. And anyways, thank you very much.
Thank you. So the idea of post-traumatic growth, which is actually a key part of that. Thank you. This was a fabulous panel, and I appreciate your time and participation. Thank you. Let's give them all a hand. And is Michelle Bell here?